If you don't recognize the voice that's in chat with me, it is my man Monster TV. He's a fellow mental health professional, which is wild because we didn't meet under that pretext. We literally met in a random LFG group for Destiny 1 back in like 2014. We got a good almost 2 hours to chat. One of the cool things about Monster being a psychiatric pharmacist is that he gets to answer questions that I never can, which is questions about medications, questions about what it's like to work in hospital settings, questions about med management for severe mental illness, all sorts of stuff that generally, if you ask me, I'm going to have to say, I'm not the guy for that. So it's really a cool opportunity to have him to be able to answer those questions. He also sent me a neat little activity thing that he uses that I'll let him introduce, that once we get rolling for a little while and we get more people in here, we have kind of a cool activity that he uses to gauge people's attitudes towards medication that you may be able to use for your own self-insight, which I think is super neat. So I just realized.
Yeah, to piggyback off that, yeah, it's something that I actually use for my patient groups, and it just kind of gets the group going, get some discussion about kind of values and beliefs about medications, and it's just, I don't know, it's just really good to, opener, yes. Break the ice.
The question, I downloaded it and I was like, oh yeah, those are cool questions, which I mean, even I might use those at some point. Like if I was starting to talk to somebody about, hey, maybe medication is worth pursuing, and talking to a pharmacist about it might be helpful for me to even be able to do an assessment on where somebody's at using those questions. So, okay. So the first question to get it started off was, how does one become a psychiatric pharmacist?
So actually, like, I'm not I would say a traditional pharmacist. Even when I was going into pharmacy school, I thought there was only, retail pharmacies. I think Walgreens, CVS, filling prescriptions, putting them in a bottle, all the traditional, things you think of when you think of pharmacist, and then hospital pharmacy. But once I got into pharmacy school, you find out there's a lot more available to offer. So you can actually go into like oncology, you can specialize in critical care, infectious disease, mental health, primary care. There's actually, like, you can go to industry, you can go into researching medications, making new medications. You actually can go into working for insurance companies and be drug reps.
Can you really
sell medication? Yeah, it's actually crazy, just like how much pharmacy degree has to offer.
I did not know that was a possibility with that. I guess it makes sense, but yeah. Wow. Anyway, continue. I just that baffled me.
But pharmacy school is generally 4 years. Some schools require you to do at least 2 years of undergrad. My school required to do 4 years of undergrad and then 4 years of pharmacy school. And then if you want to do any sort of kind of clinical position, like what I'm doing, you have to do pretty much 1 or 2 years of residency. So I did 1 year. The first year is more generalized, where you kind of get, learn from different rotations from various aspects, again, cam care, critical care, psych, whatever it may be. And then the second year, you can specialize in, again, whatever field that you want to go into. So mine was psych, so I went to a different VA hospital, and all of my rotations were in psych. So I got substance abuse, worked on for a couple months on an acute serious mental illness unit, did some pain clinic, general just depression, PTSD, anxiety, did outpatient pharmacy as well, to where I actually had my own patient appointments with individuals, about 30 to 45 minutes, and we would go over and do some med management with them about their medications, provide education about adverse effects, how are things going with them, and make adjustments accordingly. So actually, in the VA setting and in some places across the country, we act as a more mid-level provider, like a nurse practitioner, where we can adjust medications, order labs, make referrals, Dr. Mick, all that good stuff. So it's kind of cool.
Here we go. And where'd you go to school?
I went to the University of Nebraska Medical Center.
Cornhusker.
Yeah, Cornhusker through and through. And then, so I actually so I did all my schooling in Nebraska, and then for residency, I actually went to Alabama for a year. And then when I specialized in psych, I actually went to Pennsylvania, lived in Pittsburgh for a year, and now I'm currently in Ohio. So I've kind of traveled around a little bit here, kind of seen some different areas of the country, which has been cool. So. Let's
My
see where I
man
ended up though.
has done a lot of school, and you had to do residency, which is not something that I ever had to do, which is part of the reason I didn't even want to go be a psychiatrist, because I didn't want to do a medical residency or go to med school. So good on you, man, for being willing to do that shit, because that was not for me. Can you talk a bit about what enforcing boundaries means to you? A close friend of almost 10 years has been repeatedly breaking really the only boundary I set with him. It has to do with simple communication. I know they have anxiety around communication, so I've tried to give him as much benefit of the doubt as possible. But it's gotten to a point where if I don't enforce the boundary, it just doesn't exist. I'm really frustrated with them after the last occurrence, but I'm not sure how to enforce that boundary without feeling like I'm punishing them. I feel like I've made my feelings and boundary very clear in the past, so I don't see much point in refreshing it with them again. Well, the thing about it, Coder, is that a boundary may indeed it may actually be a punishment. In some ways, setting a boundary is an attempt to try to minimize a continued behavior or extinguish that behavior. So, if that person perceives it as a punishment, that's not your problem. Your boundaries are important. And if you've made it clear and they continue to be violated, you're correct that it's not a boundary until it's reinforced. So, enforcing means following through with the consequence, and sometimes it means escalating the consequences. And if that means that you maybe have to minimize the interactions with that person, or it starts to become more punitive, that's part of the gig, unfortunately, because when people don't respect your boundaries, they have to have them firmed up. I was wondering, what point does weight gain from medication become a problem? How can I be sure that it comes from a medication? Is there anything I can do to prevent that sort of significant weight gain from medication?
Yeah, so that's actually, especially with, you may not be talking about psychiatric medications, but for psych medications, that's a very common
Oh, yeah.
side effect is weight gain, and that's something that we counsel our medications all the time on, because that's usually their main concern is this gonna, is this gonna gain weight? And the best thing I can just say is, just try to be aware of it. There's, just try to eat right, exercise regularly. There is actually a medications that can help with weight gain, specifically with psychotropics. It's actually a diabetes medication, but otherwise, yeah, it's just kind of the basics of eating right, exercising on the regular.
Is that a thing that a person could request? Because I actually like that question, because sometimes when I'm working with clients, one of the primary reasons that people are afraid to start medication and will be averse to it is because of the weight gain. Is that something that, like, if I was to say, hey, if you're talking to a psychiatrist about this stuff, you might also consider requesting this because this might help with the weight gain? Or is that something you guys have to decide?
I think, yeah, bringing up with the doctor and kind of being like advocating for yourself, I think is always a good thing. So I think be like, hey, I heard this, it's metformin. I heard this helps with weight gain associated with psych medications. Is this something that would be clinically appropriate for me to try? I don't think there's anything wrong with doing that.
Cool. Yeah, I just always wonder about that stuff, because sometimes I think people get, and I say this as somebody who, as a professional that does not really work with medication, I myself deal with this too, where I think sometimes when it comes to meds, we look at psychiatrists and we look at pharmacists and general practitioners, and we basically look at them and say, well, they know what they're doing with this stuff. I don't want to be that guy that, looks like he saw a commercial for X drug and then comes in and says, hey, they told me to talk to my doctor about this, and I really would like to do this. And I think sometimes people get that messed up with what actual medication advocacy looks like and asking about certain things. And so I appreciate knowing that it's a possibility for people to, like, bring that up, because ultimately the doctor's going to decide what's best for you.
Absolutely, and I think it all goes in on like how somebody would approach that question. Because I have had patients come in and essentially kind of demand to be on certain medications, and it's like, well, it's not really how it works, right? But I think if you approach it from more of a kind of learning and kind of a inquisitive, like, curiosity, like, hey, is this something that might be beneficial for me? Because they might not be aware of it either, and they might be able to look at some studies or something, be like, yeah, this might work,
Question for the pharmacist: are there good meds for my dog who has seizures? I don't know if that's in your wheelhouse or not.
Oh, interesting. I would actually have to look into that because it's been a while. I did take a vet pharmacy rotation as a student, which was really cool, but I would have to look into that because their medications, can be very similar to human meds, but the doses are different, and there are some medications that are specific for animals. But I think there are benzodiazepines that would be beneficial to help with seizures.
So I actually have
sure
a
there's-
follow-up to that question based on your answer there, because I know many people that have at the least thought about this or have done it. What's your official stance on people giving their pets human meds?
So I think, like, for example, if your pet is like kind of like really itchy, think like giving, I believe Benadryl is the one that people have used before. I think just, if I always just say, make sure you call your vet or talk with your vet before you do it, because that's going to be a really bad day, right? If you accidentally give your pet something that harms them in some way, or just, I wouldn't want to risk it as a having pets and growing up with pets. So
Yeah,
if you're
man.
not sure, double check.
I think people do that. They do that thinking that it's in the best interest of their animal, but animals have different physiologies than humans and
Yep,
stuff. Like
exactly.
you have to be so careful with that shit. So I wanted to hear your thought on that. Whoa,
Yeah,
what
no,
the hell?
echo that for sure. All right, I got some questions in here on my chat.
Cool, go for it, man.
So Sierra said, on the flip side of the medication point, is there a concern with stimulants in the case of exercise? Obviously, you're probably not pound a thing of C4 before the gym after taking Adderall, but is there a higher concern of taking it easy on just stimulants over, say, just normal pre-workout or something similar? Yeah, I think when when your doctor's like prescribing medications like stimulants or something like that, make sure you bring up like any sort of supplements that you might be on for like pre-workout or even herbals um, or vitamins that you take, because some of those supplements aren't really FDA regulated, and there could be some serious drug interactions with that. So one that comes to mind is St. John's wort, that is sometimes used for depression, but actually has a lot of drug interactions that can be pretty bad if you mix it with certain meds. So
Are there common ones that people will mix it with that you see problems from?
the main one is like warfarin. So warfarin's an anticoagulant that's used to prevent blood clots, and it can really change the INR a lot to where it's really hard to manage. So that's probably the main one I think of, but from a psych med, I'd have to look into it. But from the pre-workout thing, yeah, I mean, if you're on stimulants and it's everything, I really wouldn't go too crazy. But at the same time, I don't feel like it's any sort of risk as long as you're taking like the normal dose.
I also want to make sure that as we're answering these questions and talking, that I throw out a disclaimer that really it's an underlying point that anytime you're talking about medication that you personally are taking, make sure you talk to the person who's prescribing that medication if you ever need to make changes or are ever considering stuff like this. Monsters info here is not a replacement for that conversation with your doctor. It's for informational purposes. I'm going to throw the disclaimer in there every now and then too as
Absolutely. No, sounds good. We always forget to do it at the beginning.
Yeah, no, I do too. And then once we start talking, I'm like, oh yeah, we should be clear about this. Also, Coder, I'm glad that's helpful. I don't know that I would call that being vindictive, buddy. It sounds like you've been reasonable with your boundaries, and if you need to firm them up, that's just kind of the natural progression of firming up boundaries. That's not really vindictiveness. You know, especially if you've been giving a person the benefit of the doubt for a long period of time. What about the inverse of weight gain? Like Vinase, and it's basically eliminated my appetite, caused me to lose quite a bit of weight, and it makes eating hard as well because I basically have to force myself. Junk food tends to be all I can stomach.
Yeah, so stimulants such as Vyvanse are very common for weight loss. Well, it's essentially appetite, not stimulation, decreasing your appetite, and so that's a fairly common side effect of those medications. There are, I mean, I don't want to really advocate for always putting on medications, because I am as much of a proponent as getting rid of medications. And not always just starting them. I don't know if I have a really good, I guess, fix for fixing appetite. I guess just trying to eat maybe smaller meals throughout the day instead of trying to eat, just big meals all at once. That might be helpful.
I will say,
or maybe from your experience, Mike, you might have something.
Yeah, I mean, because obviously there's the component of what happens when you have the medication in your system, because a lot of times I will end up being the one that interfaces with people when they're struggling with eating as the result of some of the medications that they're taking. And there are times where, depending on what you're taking the medication for, It may not actually even be the medication. Sometimes it's easy for people to associate it with the medication, but it could be like,
Sure.
for example, depression tends to eliminate a person's appetite. Also, like there's times where people with PTSD, if they're in a space of hypervigilance, their appetite will go down. Also, if you're in a heightened sense of anxiety frequently, if we're talking like chronic anxiety or even like generalized anxiety disorder, if your sympathetic nervous system is firing constantly, it's going to take your appetite offline because that's part of what happens. So sometimes it has to do more with what's going on even beyond the medication or what's underlying it. And it comes down to a level of behavioral modification and getting into a new pattern. For example, sometimes when people will try to, in addressing depression, eat more regularly, they'll find themselves eating at times where they're not used to eating. And you actually have to establish that routine for your body because your body actually will get into a routine of I'm used to eating at this time. And if you start trying to eat at like 7 a.m. when you've never really done that before, your body's not going to really be ready for it. In the same way that if you try to modify a sleep schedule, you get kind of effed up by that. So
Yeah, I was actually going to bring that up too from the sleep side because I talk about that with patients all the time of like setting a schedule and sticking to it. So that makes sense with the whole eating thing as well.
yep. So sometimes it really does mean you have to kind of force it down a bit or eat, or something that I've recommended for people before is, especially like in the morning, if you're eating at a time where you're not used to eating and you find solid food hard to get down, liquid usually goes down easier. So if you have like a nutritional shake, like Ensure or something like that, or if you make like a shake out of vegetables or something like that, for a lot of people it will be easier to swallow and get it down if they have it in liquid form as opposed to eating solid foods. So that's another recommendation that sometimes I'll make for people until they get used to the pattern and eating at that time. So there's a lot that goes into it, and it's a lot of times I see people overly attach their inability to eat to the medication that they're taking, and that certainly has an effect on it, but sometimes it comes down to behavior. Related to that question, I've had doctors prescribe antihistamines for appetite before. Is that something you use sometimes with psychiatric meds?
Yeah, one of the actually it's an antidepressant, but it's called mirtazapine. It does hit histamine quite a bit, but it really increases appetite a lot. So we tend to use it for, patients who have depression have a hard time eating, but we also tend to use it a lot for patients who have cancer, and kind of just help increase that appetite stimulation. So yeah, that makes sense.
I have something that may bounce between both Dr. Mick and Monster. Having been diagnosed with depression at 13, I was put on antidepressants that increased quite significantly in dosage over the course of 2 years. From my perspective, the meds didn't help, and even at times made me physically ill after taking them. I gave up on medication entirely at 16. As an adult, I'm looking into therapy and plan to talk with a doctor about the possibility of meds. How can I move past the anxiety and hesitation of taking medication again? Are there red flag side effects that I should be looking for if I do start meds? I'll answer the first part of that question and I'll leave it for you because I sort of see this as the order of operations. Generally, a person would talk to me and then
Yeah.
they'd go to you. So the anxiety about taking meds, I think it's really important to understand the following, which is past experiences do not predict future unrelated experiences. So medication tends to affect people differently in like adolescence versus like adulthood and childhood. I do know that to be the case. I don't know specifically how, but what I will say is this. You may not even take the same medication or be prescribed the same medication. It could be that you now have good information, which is I took this before and it had adverse effects on me. So what I would be helping a person do at the outset is kind of get away from the false logic that because this happened before, it will happen again. Because a lot of times that is actually not the case. There's bodily changes that happen. There's all sorts of things that can contribute to that experience being different the second time around. So we want to create realistic expectations for that engagement that you're going to have with a psychiatrist or with your doctor or with this, or I guess with a pharmacist sometimes in your case. And we're going to kind of move through the anxiety of that way and get you prepared with questions to ask, how to articulate your experience that's happened in the past so that you are not automatically assuming that because it happened when you were young, it's going to happen again. And then at that point, if you get comfortable enough to talk to a person like Monster, he's going to tell you the following.
Yeah, I mean, to be honest, you hit it right on the head because that was very similar to what I was gonna say. Is, you know, if this is a medication that's been potentially helpful for you in the past, but you had some side effects, like Dr. Mick had just said, that doesn't mean that those side effects are going to happen again. We could try a different medication that while it might be in the same drug class, you might not have those same side effects. So it's definitely always important to try to keep an open mind with these. And one thing from like a provider standpoint, we're not just trying to give people medications just to give people medications, right? We're giving people medications that we feel are going to be helpful and have a lot of good evidence for efficacy, as well as that they're safe and have not that many side effects. Unfortunately, there are medications that do have side effects, and it's just something that like we have to manage and deal with. But for the most part, as long as you have an open conversation with your doctor and let them know, hey, what side effects are going on, because some of the side effects are just because medications are foreign to our bodies, right?
Yep.
So it takes time for our bodies to get used to these new drug levels that are in our system to help regulate our neurotransmitters, our chemicals in our brain, to kind of help fix whatever's been going on. So some of them are transient and go away as you take it or get used to the medication, and then there's going to be other side effects that don't go away. And so one example I would say is sometimes patients might get sexual dysfunction with some antidepressants.
Yep.
I've had some patients say, hey, my mental health's doing really well right now. I'm okay with this side effect.
I've had people actually say that it was helpful because it regulated their sex drive.
Yeah, so yeah, that's the thing. So the sexual dysfunction actually is kind of some different parts on what they're like what it actually affects. So yeah, because if you're having an antidepressant and your mood feels better, you might feel more, you might in the mood, I guess you could say, to have sex. But from the sexual dysfunction might be like you might have a harder try, like be impotent, or might have a hard time like reaching like orgasm or something. So
yeah, and sometimes what comes out on my end is people feel shame about that. Right. In which case, then we're kind of normalizing the fact that, like, look, this isn't you. This isn't something we have to attach to your sense of self. Like, there's literally a biological process going on that's getting messed with by virtue of the fact that you are on a medication. And with that in mind, I actually wanted to ask you, because I meant to ask you this last time we talked and I didn't, which is how often, I know you can't like put a number on it or a percentage, but your best guess, how often do people get the right medication combination on the first try?
So I do know the numbers based off like what I put into my lecture for antidepressants.
Okay.
And so it's I don't want to get people discouraged, but after one medication trial of an antidepressant, only 1/3 of patients will have remission of their symptoms.
So I'm super glad you said that. Okay, because I think too many people expect that the first crack at medication is going to work.
Okay.
And they because I run into this all the time, dude. Like people will be on a medication, like maybe I refer to a psychiatrist, or maybe they are already seeing a psychiatrist when they come to see me. And they start a medication. The psychiatrist tells them 4 to 8 weeks. We don't know. Right. It's going to depend. And then people get to the 4th week, and then they start thinking something's going to be different. We're working on different behavioral modification and cognitive, realignment, shit like that. And they get to week 6 or 7, and it's not going great, or they got symptoms or side effects that are not fun. And they go, see, I knew this wasn't going to work. I'm a lost cause, and they give up. And I think it's so important for people to understand that, like, there is a 1 in 3 chance that the first shot you take at a medication is going to help, and you got to stick with it and talk to your doctor so that they can adjust it, because your body is literally unique. Like, you actually are a snowflake as it relates to taking antipsychotic medication.
Right.
So you have to do trial and error. There's no guarantee that what works for other people is going to work for you. And I'm so glad to hear you say that, because I find that number to be more normalizing than it is discouraging, because because it helps people have realistic expectations. I think too often when we talk about medication and stuff, people have way too unrealistic of expectations about what it is that's going to happen to them when they take them. Right.
No, that's fair, because sometimes people think like everything's gonna just be better, right? It's just gonna be like all your problems are gonna go away, and I wish that was the case. But people just don't realize, like, maybe like the small things, like, oh hey, like maybe you are starting to do those things that you enjoyed, some hobbies that you stopped, but now you're doing them again, or maybe your work is better, you know, type of thing. You have more energy throughout
Mm-hmm.
the day. People don't notice those small changes, and don't contribute that to the medication or that it's doing something. You know, they're looking for that home run out of the park, and
Yeah, I
that might
mean,
just not happen right off the bat.
Zoloft is not going to fix the infidelity in your relationship, right? Like
Right,
it
right,
might
yeah.
help you have the energy to engage with your partner in a more meaningful way, and it can help me help you do that. But ultimately, there has to generally be some level of behavioral modification that comes along with whatever changes the medication is going to help bring about, because it moves your baseline. Do you think resources like BetterHelp are a good way to seek therapy? They can be. I'm not sponsored or backed by any of those services, so take what I say really as my unbiased opinion, because I don't use them. I also don't have much experience with them. I have heard people say that it was helpful to them. I have heard people say that it was not helpful at all, and then I've heard people say it's in the middle. I think it works like any other therapy service where really you got to find the right match. If the therapist you get on BetterHelp ends up being a good match, you're probably going to have a good experience. If they're not a good match, you're probably not going to have a good experience. I think it's better than nothing. I think if it's the only thing that's accessible to you, you should give it a shot. Therapists are really hard to find right now, so if that's a way of being able to get access to somebody to talk to, I say go for it. If it doesn't work out, then end. But I unfortunately, it depends on the person. It depends on who you get paired with. I think the service itself is fine from what I know. I know they've contacted me about 7 times trying to get me to join their network, and I won't do it because they do not have a particularly good way of reimbursing therapists that work for them. But
Is that your equivalent to, for me, drug reps? Just like I get so many calls from drug reps, like just like wanting
no,
to talk about their medications, and it's just like, man, bro, I can't. Got
actually, I don't.
patience.
You know what? I don't. That's actually a good question. I would say no. Actually, you know who I get? I don't know if it's because I own my own practice now or what, but I get calls all the time from like random like addiction treatment centers, and
Okay. All
I
right.
get calls from people who are like, "Hi, I want to be a resource for this particular thing." I actually got a voicemail like a week and a half ago, and literally the voicemail said the cigarette whisperer, and it was some guy who was like, "Yeah, I work with smoking cessation, but it didn't appear that he had really any credentials. It's just something that he does." And he was like, "Send people my way if they're having trouble with smoking cessation." Like, I get that
You're like,
shit all the time.
okay.
But BetterHelp, no, not really. They've reached out to me, a handful of times, but they're not annoying about it. They're usually just like,
Right.
"Hey,
Okay.
if you need clients, if you're having a hard time getting set up, we'd love to get people your way, and we're trying to build our network and yada yada." And I just say no, I don't
Gotcha.
need it at this time, and then they're cool. So, but
What's
yeah, no,
up,
I can
D?
imagine you get calls all the time from drug reps. That's got to be
Yeah, we
just
got D
absolutely
chopping in
bananas.
here too. Yeah, it's crazy. And they always like take up so much time of the day. I'm like, I gotta go, man.
Yeah, I
I have
don't have time for
patience.
this shit.
I got some questions over in my
Go for
chat.
it, man.
Sierra's been popping off over here. So
I see how
first
it
one
is,
he's got
Sierra.
here.
I love how my mods are over at your.
Oh, he's my mod too,
Oh,
bro.
is he really? That's
He's not
awesome.
just yours. Yeah.
All right, all
I
right.
had to steal
I
him.
mean, you probably pay him better than I do, so I understand.
Yeah, it's true. Yeah. He said, "What qualifies a medication for off-label usage?" And he said, "I get that it's a lesser tested secondary use, but at what point does it become acceptable to prescribe?"
What point does it become Viagra?
Yes. What point does it come Viagra? So that's a very interesting thing. So yeah, for those that don't know, there are medications that are FDA approved medications for specific things. So for example, Zolof that we use is FDA approved to treat major depressive disorder. But then there's other uses that these medications can be used for that may not be FDA approved, which just means they may not have been studied or researched to meet, I guess, that criteria for the FDA. And the thing is with that is like companies that want to get FDA approval have to have all sorts of funding and research done to prove that it is safe and effective for whatever indication that they want to get FDA approved for. So the thing with off-label usage is actually any medication can be used for off-label usage, right? So if I wanted to use Zoloft, which obviously doesn't, or sertraline for generic terms, for say as an anti-cancer medication, that's technically an off-label usage, but we know that medication is not going to be effective to treat cancer. So essentially, it just opens a doctor up to a bunch of liability if they're using a medication off-label that isn't essentially deemed safe and effective for that treatment. So medications don't have to go through FDA approval to be used for that, but usually if doctors are going to use medications off-label, there is some sort of either case reports being done, randomized controlled trials that are done outside of the manufacturer, like just researchers looking into that topic to use those medications for it. So, hope that answers that. Does that make sense?
Makes sense. I mean, it makes sense to me. Ciora will let you know, I'm sure, if it makes sense for him.
Oh, I'm sure he will. If it does.
Question for Monster: as someone who used to take medication for ADHD, who did for nearly 15 years, and one issue I used to have was having like a robotic feeling, kind of like going through the day and not having any emotions at all. Why does this happen?
That's interesting. I haven't heard that much with stimulants. Usually, people usually get a little bit more calm. Oh, I got wrecked.
Holy shit, I did too. I got booted.
Do you mind, whoever asked that question, if you tell me what medication you were on? Because I feel like the newer ones that they have now, that's not usually one I would recommend, or not recommend, one that I see that side effect with. It could be though, maybe you were just not on the right stimulant, and maybe the concentration of that stimulant was either like too high or maybe too low, where it affected those neurotransmitters in a way to kind of not regulate at a good level. Is what I would say.
Yeah, so Mary, if you want to follow up and tag me and let me know which medication it was, I can relay that to Monster. I remember reading that some sort of medication was used to calm a mother after her baby was born because she was crying a lot and emotionally overwhelmed. Would that run the risk of the medication getting into the baby from mom?
Is this before or after?
I'm assuming it's after delivery.
So, I mean, if the...
I'm assuming through breast milk would be the...
Yeah, so with some of like the psych medications, some are obviously not good for breastfeeding and can have adverse effects in the infant. But some medications, as long as you like essentially take the medication like in the morning, and then if you breastfeed right before you're supposed to take that next dose, that's going to be the level that the drug is the lowest in your body. So that's usually how they time it if they need be. Or sometimes providers will just say do kind of like a drug holiday, where depending on the situation, that they'll just kind of take a short break with that medication while the child's breastfeeding, and then kind of go from there if there's severe risk for adverse reactions and stuff.
Mary said this is the ADHD medication.
Oh, okay.
She said it happened with a variety of medicines. I remember mostly with Focalin and Stratra.
Stratera.
There we go.
It's okay. Actually, my girlfriend walked in and she took her first pharmacology class for her nursing school, and it was just so funny that somebody that's not in pharmacy to pronounce medications, because they're difficult for me, but then just hearing somebody else is just kind of funny.
Yeah, I'm not great with pronouncing medications at all.
But Stratera, yeah, usually stimulants don't do that, so I don't know. Maybe it could have been another medication that you're on, or if it was the only one, then it probably was the case, or maybe there were some other environmental factors that may be occurring during that time. But yeah, I would say it's probably just some sort of chemical imbalance that the medications cause, or maybe too much of one too much of serotonin or norepinephrine compared to another. Madame asks, which is another ADHD question, says, I have a big question. I heard once that if someone who does not have ADHD takes a stimulant medication for ADHD, they will fly off the handle. While if someone does have ADHD, it'll work for them and focus them. Is that true? Yeah, so exactly. So somebody who does not have ADHD, how stimulants work is that kind of floods these spaces in our brain called the synapse that are between our neurons, which kind of signal for activities and stuff. So somebody who doesn't have ADHD doesn't kind of have that deficiency in that level. So they essentially have a normal amount of chemicals. We give them a medication that further elevates those levels in our brain, which causes them to a little bit be more hyperactive, have more energy, and kind of all the things that stimulants do. whereas somebody who does have ADHD kind of has a lowering amount of those chemicals in the brain. So where, yeah, when they do take a medication, it kind of normalizes those chemicals, thus being able to kind of slow them down and focus on their task at hand. So that is true.
Is it true that dry swallowing Zoloft can burn a hole in your esophagus?
I have never heard that. I haven't.
Apparently, that's circulating around the Zolof Reddit subreddit. I didn't even know there was a Zolof subreddit.
Actually, there's a lot of stuff on Reddit regarding medications and even some, like, obviously some illicit substances,
Yeah,
drugs, stuff. So
I know of like R trees, but I didn't realize there was R Zoloft.
yeah, there's like R psychedelics. It's crazy out there.
I was put on a lower dose lamotrigine for TRD treatment-resistant depression and don't have epilepsy as it is usually used for. How does this drug work in the body to affect depression if I don't have epilepsy?
Sure. So actually, it isn't used for epilepsy, but we also use it as a mood stabilizer. And from a mood stabilizer standpoint, we really actually don't know how it works, which is common with a lot of the mood stabilizers, such as lithium and Depakote. We have like an idea, you know, they work on various calcium and sodium channels in our brain and stuff, but we don't have that exact mechanism down. So usually when people ask like about lithium, I just say it's magic.
That's what everybody, yeah, like literally. It's so funny to hear you say that because I hear other people say that of like, you don't ask. It's just magic. It's
just
literally a miracle drug. Like there you go.
So I don't really have a great answer for you as far as how does it work, but it does have really great evidence for using as like adjunct to like an SSRI or another antidepressant. And from my clinical experience, like with using it for patients, they've done really well on it. So.
I've been off my meds for about 4 days now. I'm on an antidepressant and ADHD med. My delinquency has been on purpose. If I sleep too late, I don't want to take my meds because they keep me awake, but now I'm sleeping for 10 to 15 hours at a time, and I sleep through everything. I've also been sleeping too late to take my meds, so it compounds the issue. What's a good way to break the cycle if I'm on a schedule where I'm up until 3 or 5 a.m., regardless of what I do? Well, that one's
a question for you.
Yeah, I say that one's maybe more of a question for me. So, Vlad, I appreciate that question a lot. That's a tough one because I don't know all of the circumstantial, environmental stuff that's going into that process for you. What I will say is this: that in some ways, when people have to be on a certain drug regimen, or if they're dealing with something else, there is a level of discipline that's required in that. If you know that you need to take a medication in a certain window, it's sort of similar to like when women take birth control at a certain time every day. If you know that you need to take a medication at a certain time in order for it to be effective and work for you in the way that you want it to, you may have to like set alarms. You may have to create a sleep schedule. There's a lot of behavioral modification that's going to have to go into building the discipline to make sure that you are taking your medication when it's best for you. So it's one of those things where like you may need the assistance of a therapist in that space to be able to help you with that behavioral modification to create a treatment plan that's going to be really effective for you. It's hard for me to know specifically what would work, and I'm sure there's all sorts of reasons why it is the way that it currently is. But ultimately, we do have to build some form of disciplinary regimen around medication, particularly if that's something that's a main primary source of whatever it is that is like of treating whatever it is that's going on for you. So that's really what it comes down to on my end for that. When my dad was alive, his psychiatrist diagnosed him with medication-resistant depression. I've tried so many over the years and have not had any relief from them. Is it likely that mine is resistant too?
Yeah, so I will say with mental illness, there is a very, very big genetic component to that. And that's actually one of the factors that, like, when we're selecting medications, we do look at. So if a family member, like, for example, your dad did well on like Celexa or Zolof or something like that, then we would also try that medication for you first as well. And vice versa. Like, if they didn't do well on a medication, then we would likely not try that one in you as well. So it very well might be the case, but I think somebody like a provider would still kind of go through, kind of the treatment algorithm to select the medications, just in case that does work. It doesn't mean that it's not going to work. And and kind of give it a shot. Kind of what we talked about earlier, if you were here in the stream, about past factors don't necessarily correlate with what's going to happen in the future, right? So just try to keep an open mind, because if you go into it with a negative attitude, like this isn't going to work, then it probably isn't going to. Mindset's a big thing with mental health.
It really is.
Therapy, but also with medications.
That is so, like, I really think that's so underemphasized, and people tend to, like, kind of roll their eyes at that because it sounds so cliche that somehow your mindset could have something to do with that, but it is so true. Like, if you are, and now depression makes this difficult because depression has a way of wiggling its way into people's brains and making it so that it's very hard to be motivated or excited or hopeful about treatment. But that's where some level of cognitive work is super important, because your mindset when you're engaging in therapy and when you're engaging with medication does make a difference. It's sort of like the same thing that when people will talk about people going through like cancer treatments and stuff, like attitude through cancer treatments actually does make a difference. And that can be a really hard thing for a person with depression to go into. It also can be demoralizing if you're going through multiple different types of medication to find the right one. And that's where discipline's going to get you through better than motivation, which is why I preach discipline all the time over motivation. I know that a common tactic in the entertainment industry is to use countdowns and other techniques to build suspense and leverage the adrenaline rush or shot feeling. Have there been cases of people that need certain medications to moderate their feelings in response to these types of stimuli, whether too low or too high?
I would say, so there is a medication that we use for performance anxiety. I think that's kind of what we're potentially getting at. It's called propranolol. It's a beta blocker. It's also used for anxiety. Also used for blood pressure.
Pronounce that again for me.
Propranolol?
Damn it, I've been pronouncing that wrong for a long time and nobody's ever corrected me. Okay, anyway. It's one I know of because I work with performance, so.
Oh, sure. Yeah. So that one's pretty common that we use to kind of help with maybe some anxiety around social speaking in like social situations, giving presentations.
Test anxiety is another one I've seen it.
Yeah.
Yep.
Yeah. So yeah, we definitely use medications for that. That's the one that comes to mind immediately, but I don't treat that patient population a lot, so I'm not as familiar.
I know we got this question last time, but I wanted to ask it again because I think it's a pretty quick answer, but it's one that I think a lot of people always want to know, which is, what is your perception of or experience with doctors receiving kickbacks from pharmaceutical companies for prescribing certain medications? Because I know people worry about this a lot, and I like to address it every time I've got you, because I just think it's important for people to hear the answer to that.
I'm not sure how common it is with for example, at the hospital that I work at or the VA that I did my residency in, those kickbacks do not happen. I can pretty much confirm that. So a medication that's going to be prescribed to you in those settings, I would say try not to worry about that, because that's not the case. So we're going to try to choose the best medication that we can for you that's safe and effective. Like, that's my job, is to come up with that. And I've had so cost is a very big thing for me, and some of those medications that patients are getting, or not patients, doctors may get kickbacks for, are kind of those more expensive brand name medications. And I always try to preach to my medical students and residents that I have that, if patients can't afford their medications, they're not going to take their medications.
Right.
So it's always really important to take costs into account when we're trying to pick the best medication for them. From a private sector standpoint, I would say there's maybe some doctors out there that do that, but I would say the vast majority don't. I feel like most of the doctors that are in the mental health field are in it for a reason.
Yep.
Whether from a personal dilemma that they've had, maybe family members, and I would say that they care.
Yeah,
I mean, for everybody. I mean, I know I care, but
it's the common misconception, even with mine, which is that people think that we want people to be struggling because we keep our job. I can tell you right now that if my entire caseload all of a sudden was like better and said that they felt better and didn't need to see me anymore, I'd have another full caseload within 2 weeks, because I'm having to turn people down. So I don't have a vested interest in my clients not doing well. I have a vested interest in my clients like doing better. That's why I got into this, and it's why most
Exactly.
people in healthcare professions got into it. They want to help. They don't want to. They're not in it to like make a shitload of money from a pharmaceutical company. Are there some bad eggs? Yes, but you don't want to like let a very small percentage spoil the good that so many others do. It's far more it's disproportionate in the form of people who do well versus people who are selfish. When a patient's on medication, how do you determine when a patient should eventually be taken or taper off the medication? Do you go based off how the patient's reacting and feeling over time, or is there a timeline?
Sure. So some medications have therapeutic drug levels that we have to, get like lab values for. You have to go, get blood, and so we try to target that therapeutic range. So, for example, one that comes to mind is lithium. Its therapeutic levels are 0.6 to 1.2. So if it's not in that range, then we're going to increase the dose to make sure it's therapeutic and that you guys are getting benefit from that medication. So we'll look at those drug levels, but then yeah, sometimes it's kind of all about how how you guys are feeling, right? So if you guys are feeling better on the medication and it's like a good like therapeutic dose, then yeah, we're not gonna go off on a medication that we don't need to, because that's just gonna put you at a higher risk for potential side effects. If you can get away on, 100 milligrams of sertraline or 20 milligrams of Prozac, then that's great. But sometimes it just kind of goes down based off your guys' experience and what's been going on. Now, what Dr. Mick mentioned earlier, that the like antidepressants take some time for them to work. So they could take anywhere between like 4 to 8 weeks, maybe even up to 12 weeks in some cases. So we really want to try to make sure we give the medication an adequate amount of time that's at a good therapeutic dose before we deem anything a failure. Because I see that a lot from a pharmacy standpoint. Somebody might try a couple doses like while they're inpatient and be like, oh, this is not working. Well, we didn't really give it that much time to work. It takes a while for these chemicals to regulate in our brain and change all of the receptors that they need to in order for
Business
the
now.
things to take effect.
Pleasure later.
I want to add too, because I think it's important for people to hear these types of things, which is sometimes when you're taking a certain medication and you start feeling better and you're also engaging in the behavioral modification that goes along with it, that doesn't mean that it's time to go off the med. There are some medications that people end up taking for a large chunk of their life because that is what is keeping them stabilized. It's what's giving them the the energy to continue doing the good habits that they've been building, either through talk therapy or on their own. I think sometimes what gets in the way of people wanting being okay with that is a sense of like that they're weak, or that because there's a medication that's stabilizing you that's somehow bad. And that's not true. It's no different than if you get regular migraines and you take a certain migraine med and it makes them better. Like, why would you stop doing that? Or if you take allergy medication every spring when you have allergies, like there's no shame in psychotropic drugs in the same way there's no shame in taking Advil for a headache. And sometimes you need to have those like lithium for your entire life, because that's what keeps things stabilized and your body gets habituated to that. You build a new internal homeostasis around that, and there's really no shame in that. I so often see people get caught in a shame spiral with medication, and they want to get off the medication not because the medication's harmful to them or because of the side effects, but because they just don't want to be on medication.
Right.
And if the medication's helping stabilize you and put you in a good spot and helping you achieve all the things that you've been wanting to achieve and make all the changes you've been wanting to make, why on earth would you stop doing that?
Right.
Only because there's some idea that you're somehow weak for having that in your system. So I wanted to add that piece because that's the one that I end up running into all the time with people. There is no shame in taking medication for your mental health. There's just not.
Yeah, no, exactly. I hear that all the time as well, especially with my patient scripts. It's actually a perfect segue, because that's actually one of the things on that sheet is talking about how you feel weak when taking because you have to take a medication, and that's like the number one that we value or belief that we end up talking about because of that. And it's just like there's nothing wrong with having it's like you mentioned for migraine or allergies. I compare it to diabetes or high blood pressure, right? Because we can do all these lifestyle modifications, right, with those, like eating right, exercising to lower blood sugars or blood pressure, but sometimes we just still need medications to further lower it to reduce our risk for strokes and heart attacks,
Yep.
all that. So it's okay to get store-bought serotonin, it's okay.
It's fine if you need melatonin to help you sleep, shit like that. Absolutely. All right, let's see. Can medication be... Oh, I think we might have answered this. Can medication be temporary, or is it a forever thing? I'm on some meds for generalized anxiety disorder and chronic PTSD in conjunction with therapy. Lexapro and propranolol. God damn it, I never say it right. But could the PTSD meds, thank you, be temporary thing? I've never heard folks talking about ending meds just starting. I think we might have answered that. Katie, if we answered that, let me know. Or if you want to expand on that, Monster, go for it.
Yeah, I'll expand on it a little bit. And I think pretty much it comes down to it depends on so many situations, severity. The biggest thing I can say is please just have an open conversation with your doctor about what's been going on. And there, we might be able to try like going down on the dose and see how things go. But some of these medications can have really bad withdrawal side effects if you abruptly stop the medication. So definitely don't recommend going cold turkey by any means. So just again, have an open conversation with your doctor. Like Dr. Mick said, sometimes maybe people can be them on for 6 months or a year, and then kind of reassess how things are going. Sometimes it's lifelong. It just kind of depends on everybody's situation, what they got going on.
When it comes to medication for things like bipolar type 2 in my case, can it be an indication of an incorrect diagnosis if something like an antipsychotic works for what was believed to be depression when it's much more commonly prescribed for bipolar? I went through countless depression medications with no success until I asked about the possibility of bipolar. When I switched medications, it was the first one that worked. They haven't done much other diagnosis work. Does the med change working mean I have bipolar and not depression? I'm going to answer that last question really quick, which is we can't answer that question for you, Purple. Only the person who's done an assessment with you can answer that question. So whether it's bipolar and not depression, you got to have a conversation with your doctor and the person who's prescribing for this. And then I'll let you take it from there.
Yeah, I mean, as far as like the very much like what Dr. Mick said, we can't really make that without doing like a full workup on somebody. But we have seen sometimes, or an example of this is, we have a young adolescent that comes in for depression, and sometimes we treat them with antidepressants, which actually, if they do have an underlying bipolar diagnosis that we're just not aware about, sometimes it can switch them into a manic state. And if that does occur, then like, okay, it probably just wasn't depression, it's probably some sort of bipolar disorder. But there are, like you had mentioned, there's some medications that can treat both bipolar disorder and depression. So it could just be it's just hitting different receptors in our brain that the depression was affecting in you versus maybe the more traditional depression presentation.
By the way, that's frequently how bipolar gets diagnosed. Usually people are in the depressive side of bipolar much longer than manic, because mania is not really sustainable in the long run. And so usually people will come when depressed, because when they're manic, they generally feel fine, even though mania is far more destructive. And so
they feel great.
Yeah, sometimes it will appear like depression, and we have no way of really seeing it otherwise unless a person knows like the perfect questions to ask, and even then sometimes it's hard. So frequently bipolar gets diagnosed when a person goes on an antidepressant, and then all of a sudden they come to me and they're manic, and I'm like, oh shit, we need to get you back in with your psychiatrist, because it may not be depression. So it's useful in that way. For someone who's super forgetful of the everyday little things, are there things that can help to remember to take medications and vitamins, behaviors, or routines to set as reminders? Yeah, you have to force it, Floaty. So put notes everywhere. Put things where
phone apps.
Put things where you're guaranteed to find them. Put your like, if you know you have to drive to work every day and you have your antidepressants you have to take before work, put your keys on top of the tin that your antidepressants are in.
Absolutely.
Like, literally, I had I tell this story a lot. So when I was in middle school and high school, I played the trumpet, and I had a guy that I saw once a week for private lessons. And what he would do is anytime we talked about something where he needed to remember something we talked about, whether it was like to find a new book for me to be able to play out of or whatever, he had these little tiny sticky notes, and he would write the note, fold it, and put it in his pocket, because he knew that at the end of every day he was going to empty his pockets. And all of a
Oh,
sudden, all the notes from the day would spill out, and then he would basically plan for 20 minutes before bed to do every single thing that was on those notes. You can create a system that works for you, but ultimately, yeah, put things in the way. Put things where you absolutely can't miss them. Set 20 alarms on your phone. I swear to God, the thing that gets in the way of people setting their alarms and doing all these things that I'm talking about is the shame associated with doing it. People somehow think that, like, if you're doing those things, you're some kind of like jackass or a loser, or you can't get your shit together. If it helps
hmm
and it makes sure that you're getting your medications in and it makes sure you're doing what you're doing, who the fuck cares whether it looks weird or not? Like, it really,
exactly.
it's like, seriously, one of the things that drives me nuts as a therapist is when we start talking about that kind of thing and get into behavioral modification and we get into reminders and we get into habit replacement and behavioral replacement, is like, you have to create a system for yourself. And people get so ashamed of that system and get so up in their heads about it that they won't do it. And it drives me nuts because it helps. So you have to set a system that works for you, but make sure the stuff that's super important is in the way where you can't miss it. Force it. And you got to build discipline in order to continue doing that. Can hormonal changes alter a medication's effectiveness, such as menopause and antidepressants?
Yeah, so one that comes to mind is birth control, and actually lamotrigine can cause those lamotrigine levels to decrease.
What is
So you may need a higher.
lamotrigine?
Lamotrigine is the mood stabilizer we talked about
Okay,
earlier.
cool.
Somebody's question. But can be used for bipolar depression, adjunct for major depressive disorder, can also be used for seizures. Got a number of uses.
Is there a difference in how the body metabolizes brand name versus generic name drugs? Or are they just the exact same thing with different names?
They are the exact same thing, so they actually have to be the exact same thing, like within a certain percentage. Um, but the core active ingredient of that medication, or like the generic and brand name, are the exact same thing. So the excipients, maybe like the powder that they fill the capsule with, or something like that. The dye might be different, like if it's a red versus a blue, might be different, but the actual medication is the exact same. So really, there's no point, I would say, to get the brand name over
That was going to
a
be my next
generic.
question. Is there any time that there's a circumstance where you would recommend a brand name over a generic?
The only medication I would say that matters is thyroid medications. Those matter. So if you're outside the hospital, you use a specific like medication, brand name thyroid medication, and then you go into the hospital where they might not carry that formulation, that could affect your thyroid levels. So, but
Oh,
from a psych medication standpoint, no.
there we go. I'm glad I asked that. That's actually really interesting to know.
I actually have a question for you.
Yeah, go
Mick.
for it.
What is something that you see providers or pharmacists, other healthcare providers, like maybe not necessarily a mistake or something that they could be doing better, um, to kind of either help with medications or from like getting patients into therapy, or it's kind of a broad
Oh,
question. But
I got an answer for you right away as soon as you asked it. Be more available.
be more available. Okay.
I gotta tell you, man, getting a hold of psychiatrists is a fucking nightmare. And sending clients on the journey to get in touch with psychiatrists is often a nightmare. I can't tell you how many times I have had a sense from a psychiatrist that I have reached out to that they are annoyed with me for reaching out to them.
Wow.
Um,
Okay.
there is some kind, I don't know what, it's not every psychiatrist, but we have a hot list in a group of like people that I consult with. We have a hot list of who are the psychiatrists you should reach out to and who are the ones you should absolutely avoid. And the things that generally comes down to is their manner with patients and their availability and the way that they interact with us when we make referrals. I don't know what the deal is. I don't know why that happens, but I've had way too many clients tell me that when they met with their psychiatrist had them in the waiting room, brought them in, did the paperwork, talked to them for about 5 minutes, 10 minutes, said, yeah, here, we'll try this medication, and then shooed them out without answering their questions. Like,
Oh
one
my
of the things
gosh,
that
that's so sad.
it really is. And like, one of the things I love about doing these conversations with you is we get a chance to actually talk through and answer these questions with a level of depth. I think the reason so many people come to these streams and ask these questions in the way that they do is because they don't get these answers from their doctors.
Sure.
And I get 50 minutes a week with people, so I get a chance to really get to know them and stuff. But man, if there's anything you could drill into psychiatrists and into, I mean, I don't really interact with pharmacists often, so that's not one that I
Right.
have. But like, psychiatrists really can be a pain in the ass, and for a lot of, and I've never really understood it. GPs, I understand. GPs are busy. GPs are constantly doing shit, and it blows my mind that they
Sure.
even have time for themselves. But psychiatrists, I've met a couple psychiatrists that are super busy, but psychiatrists usually keep a nice, manageable caseload. So I've never understood those interactions. So that would be the one thing that drives me
Yeah, and
crazy.
that's actually kind of nice from like, I don't know if there's like a resource out there to like refer to a psych pharmacist, because I'm thinking because it's not as common that we have outpatients in the private sector. It's definitely pretty common to see a psych pharmacist for mental health in the VA, but it is becoming like more as acceptable, I guess, to see a psych pharmacist, who has the training to
Sure.
manage. Um, but that's actually one thing that like I'm trying to do at the place that I'm working, is actually set up an outpatient mental health clinic that's ran by pharmacists to help increase
Oh,
access
that'd
for
be awesome.
patients. Because like you said, psychiatrists are, they are busy, they see a lot of patients,
Sure.
and sometimes it takes, a couple months to even get in to see them, and then they're so rushed, like you said, to really be able to actually sit down and have a conversation that's beneficial for the patient. They're coming in for patients coming in for a reason, right? They want help.
Yeah,
So
man.
they're
And they're often really
pushed
scared
off.
of it. Like,
Mhm.
I mean, when somebody says, "Here, put this in your body for 4 to 6 weeks," but doesn't really give an
Mhm.
explanation for what it's going to do and why it's and what it's going to affect and all this stuff. I mean, it's gut wrenching when people come back and say, "Yeah, I tried to talk to a psychiatrist, but like I really didn't have a good experience." And
Right.
I hear that way too often for my liking. So I like that question. I also just got a flood of questions. So I've been on the same birth control for 10 years now. I'm curious if time of use can negate effectiveness. How do I know this birth control is the best one for me hormonally? Sure, I've been on it for 10 years and had no issues, but could it have some hidden side effects that I'm not noticing, such as being unable to lose weight, etc.?
Yeah, so birth control can cause weight gain. But I would say, yeah, if you're not having any sort of major issues, hormonal issues, and you've been on it for that long, I wouldn't expect it to be doing some underlying thing that's not noticeable, especially for being on it that long. If something was going to happen, it probably would have happened by now. Um, but usually birth controls don't really, I guess, wear off, or your body doesn't necessarily build a tolerance to it, so it should still be effective. I haven't heard of any sort of research or guidelines on switching birth controls after being on them for so long.
Not sure how to word it. Is there any set time for each medication at which one can say it isn't working instead of just giving it more time? Is there an amount of patients I should grant a medication before I see results? I could answer this one super fast. Your doctor will tell you the window, and you should converse with them
Mhm.
during that window. I mean, really, that's what it comes down to. I can't emphasize enough the constant communication y'all need to have with a person who is prescribing your medication. Don't be afraid to reach out to those people. Sometimes they're inaccessible, but you should badger them. It's your health. Like,
Exactly. This is the medication you're putting in your body.
yeah, yeah.
So they
So
should not be annoyed at you asking questions and wanting to learn and advocate for yourself.
something that I'll say to clients a lot when they're expressing concerns about that type of thing is like, it does not hurt to ask, because the worst thing, or maybe like the best thing that your psychiatrist could say, or your pharmacist or whatever could say is, yes, we would expect that is the thing that should be happening right now. So like if you're like, man, I'm never hungry, I can't eat, I will say, well, you should talk to the person who prescribed that medication. Person will go and ask, and the doctor will say, yep, we would totally expect that. So there's nothing to be concerned about. It's part of the process, whatever. Or the doctor's going to say, ooh, that's not a side effect that we really want to see. So maybe we need to think about either changing the dosage or getting you off of it or whatever, right? Like, but you won't know because you're not a psychiatrist, you're not a pharmacist, until you talk to the person that does know the answer. So always ask if there's anything that feels funky. You should always ask. The worst thing your doctor can say is, no, you're fine. That's exactly what we would expect. And if it becomes too distressing, then we can have a later conversation. A lot of them charge money for calling about a symptom. That is a concern. I do know that there are some psychiatrists that will charge for their time as it relates to that stuff. At the same time, that's something that if you're going to go talk to a psychiatrist, you probably should talk to them about up front, which is if I call you for, to ask questions, or is there a means of me getting information about these questions where I don't have to pay an arm and a leg for that? Generally, though, if people are seeing a psychiatrist, that psychiatrist is very likely billing insurance, and you can bill phone calls to insurance. If you're paying out of pocket, then yeah, that's a whole other story. But
yeah, and also, like my hospital uses Epic, and we use like My Chart, and that's where something that you can actually message the doctor, and it actually shows up in like if they're working inpatient that day, they'll still see all of those kind of messages where they can kind of shoot you. Essentially, it's like an email back when they get around to it.
What's the window on taking a medication if I miss my time set for it?
Yeah, so the general recommendation, like I give the example, like if you're supposed to take your medications at 9 o'clock, and you just take it like once a day, if it's around noon or so, I would say that's like probably okay. You can probably get away with taking it. But if it's now like 9 o'clock at night, I would just go ahead and skip that dose for the day, and then just kind of start again on the next day. Never double your dose unless you like specifically your doctor says that it's okay to do that. I would say for the vast majority of the time, it is never okay to double your dose. So if we're all human. I even miss taking my medication sometimes. As a pharmacist, it's I know it can be difficult. Just try to set reminders and stuff. And yeah, again, if it's been like 3-4 hours, it's probably okay if you only take it once a day. But if it's been like almost 12 and you're about to go to bed, don't worry about it.
I appreciate you doing this, dude. I always love
I
these.
appreciate you having me on. I love this stuff, man. I could talk about this all day.
As someone who has to take daily meds once a day, I've always had conflicting stories as to when the best time to take them is. Morning when you wake up, or night to let your body metabolize it as you sleep. Is that something that could be per medication, or does it matter at all? I actually really like that question because I'd be interested in the answer as well.
So I think the first one is the time that you are going to be able to remember to take the medication. Probably the most important one.
Yeah.
And then from psych medication standpoint, some medications can make you tired. Some maybe may make you a little bit more activated or stimulated. So if it does make you more activated, I would recommend to take that in the morning so it's not interfering with your sleep at night. And then like vice versa, if it makes you tired, I would maybe take it closer to bedtime, and then kind of see how things go from there. I actually have had a lot of questions with the sleep thing recently from in my Discord and your Discord about nightmares associated with like medications.
Yeah.
And so SSRIs and like SNRIs can sometimes cause vivid dreams or nightmares. So try taking it earlier in the day if possible and see if that helps alleviate the issue. Otherwise, there are some medications that can help with nightmares if they're kind of trauma based.
All right, this is the last question I'm going to take, and then we're going to do this activity for all of you. What do you think about psychedelic therapy, if anything?
I'm actually really interested in it. I think right now, I think the research that we do have is pretty interesting, and I would say promising. I'm actually part of a committee that we have here throughout the enterprise about looking at psychedelics for depression, trauma, anxiety, and definitely looking forward to seeing if that takes off and we can do some research on it. I very much practice evidence-based medicine, so I'm just kind of waiting for more scientific literature to come out about it before making some conclusions, but everything so far looks promising.
Cool. All right, so here's how we're gonna do this, chat. If you want to just answer it in your mind, that's totally fine. If you have a pen and paper handy, you can basically make a 2-column thing that says agree or disagree. Obviously, you can check the VOD on this. I will have Monster upload this into the questions for Monster's channel as well, so that you can actually have the sheet itself after the stream. So what I'm gonna do is I'm gonna have Monster introduce this, and then I'm gonna ask everybody in chat a series of questions about medication. And I'm going to let you explain to them kind of what the purpose of these questions are. And then after we read through them and people answer them and kind of see what they look like or kind of think through it, I'll let you kind of explain what the answers mean and how you use this, because Monster sent this to me before we started today, and I thought it was really cool. And I think it's kind of a useful thing for everybody to have, given that we've been talking about like medication and stuff today. And Monster and I share a passion for destigmatizing this stuff, and I think this is a really cool, like, concrete way to start thinking about medication as part of dealing with mental illness.
Yeah.
So do you want to kind of tee this up and explain kind of the context under which you use this and what you use it for?
Yeah, sure. So at my work, I do 2 patient groups a week, and kind of similar to what we've talked about earlier about kind of stigma and kind of everybody brings their own values and beliefs to the table as far as medications and their like culture surrounding it, right? So we found, like, my coworker and I, we kind of found this online. We did not create this. This is from a drug manufacturer, and it's really I just think it's a really good thing to kind of talk through and discuss. There is no right or wrong answer here. This is, just something that we're going to kind of go through and maybe, potentially change your mind, potentially not, but maybe just look at these in a different light to where, it just, I mean, again, just kind of look through these statements as far as surrounding medications and kind of maybe look at it from a different angle.
Okay, so you can do this sort of in your mind, or again, if you want to have like a piece of paper next to you, you want to have agree and disagree. These are basically like yes/no questions. I'm gonna read each one, and you just kind of think to yourself really quickly, like, what do I think? There are 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11. There's only 11 questions or 11 statements, so it's not going to be that terrible to keep track of. So there's 11 of them, and then agree or disagree. And again, this is to help kind of gauge your current attitude toward medication. And I just think I'm all for anything that helps people have some degree of insight into their experience and helps people know what some of their roadblocks are to things that can help them, otherwise known as constraints. So this is specifically for medication, as it relates for mental health, right? Or in general?
I mean, this is about medications, but I mean, some of it's kind of about culture, and
Yeah.
it can be extrapolated to mental health as well. And the document is in the questions for Monster if anybody wants to take a look at it.
Cool.
I didn't know if you're gonna bring it up on stream or not.
No, I'm just gonna kind of read each
Okay.
one.
Yeah, sounds good. I was having troubles trying to pull it up on mine. So. It is there in Dr. Mick's Discord.
Cool. So I also want to add, before I read these, I would use this in my own work as well, because I think this is helpful for people who are thinking about medication, for me to get an idea of what their learned experience is as it relates to medication, so that I might help them remove some of these constraints, particularly if we've reached a point in treatment where I think medication actually may be helpful. So this is something that I would use. This is something that Monster does use. So there's actual utility to this. And you get to have us here to kind of talk through it and analyze it for you.
Perfect.
So the first one is, I understand how medication is likely to help me. I understand how medication is likely to help me. Agree or disagree? Now, I'm gonna answer these with what I imagine most people I would like work with over my career would answer this, and then I'll be curious what your thoughts are on that. Because and if this is similar to what you see when you administer this. My hunch is that many people are going to say disagree, and I would venture a guess that that's because of what I was actually talking about earlier, which is that people sometimes get prescribed something but don't have the opportunity to ask all the questions or actually get the explanation of what specifically this is doing in their body, and thus don't quite know how it's helping, just that it could. So
yeah,
that's my sense.
That's very similar to what I see when I give these patient groups, because the vast majority of my groups are talking about antidepressants and how they work, and just kind of giving 30 minutes to an hour kind of time slot for our patients to ask us questions like how do these medications work, what side effects might we see, what monitoring needs to be done. So essentially kind of what you're saying, like they just don't have time to ask these questions, or that's what I actually try to provide with those patient groups. But yeah, that's actually very common to what I hear as well. People just don't really kind of understand like what is this going to help with, type of thing, or like you said, setting realistic expectations with what it is going to help with,
Sure.
versus what's not.
It also, I think when people don't understand things, particularly things that they're going to put into their body, that tends to increase anxiety And I think anxiety is one of the major barriers to people actually pursuing medication as part of treatment. So this would be a really useful assessment question for me, because if I see disagree there, I'm automatically going in that direction of my next question. The follow-up question to that would be, if you did understand the way in which medication could help you with this, would you be open to the idea? And we kind of work from there.
It's definitely a good follow-up question.
All right, so question number 2. Agree or disagree? I don't need to take medication once I feel better. This is an interesting one for me. I don't need to take medication once I feel better. I would say that my guess would be that the majority of people would say agree here, because I think a lot of people mistakenly think that once medication gets you to a certain point, you no longer have to use it. Whereas when we're talking a lot of times about psychotropic medication, it's going to be something that creates a baseline where really that person may actually need to be on it for a prolonged period of time, if not forever. And there's no shame in that. So my guess is that people would say agree here. What's been your experience?
Yeah, that's been my experience too. A lot of people say agree, and then when we kind of go through kind of the cycle. So a lot of times, since I work on an inpatient psych units, we kind of see patients coming in and out of the hospital frequently, and it's very much because of they start feeling better, they don't associate that with the medications, they stop them, they kind of get back into the same rut that they were in before, and they kind of decompensate and end back up in the hospital. So it's just trying to build that mindset that, oh, maybe the reason why I am doing so well is because of XYZ or medications, whatever it may be. So kind of taking that next step and kind of self-reflecting, like, why am I doing so well? Because we often, when something bad is happening, we always kind of self-reflect, like, why is my life shit right now? But we never, when things are good, we never self-reflect, like, why are things going good right now? Why are my relationships good right now? They don't, because it's like, well, if we know why things are going well, and if we get back into a rut, we can figure out what we can do to get back to that, right? So, just kind of realizing that, again, sometimes medications don't need to be lifelong, but again, just having that open conversation with the doctors with what your goals are and your concerns with it, and hopefully that they can educate you and give you time to kind of be like, I guess maybe like reassure you that like maybe you might need these medications longer than you think, just to be sure.
And that there's no shame in it, and that it's
Absolutely.
okay. I also want to validate that, like, if that's disappointing, right? Like, if you're hearing me and Monster talk about this and there's disappointment that creeps in at the idea that this is maybe something that would last a long time, if not forever, that's okay. That disappointment makes sense. And it also is something that we want to help work you in a different direction of how you're creating expectations and how you're conceptualizing what this means for you, so that you have a frame that's maybe going to help empower you as opposed to make you feel like shit. All right, question number 3. Agree or disagree? For me, the good things about medication outweigh the bad. Now, this is obviously going to be a subjective experience. I don't know that I have even a thing that I would add in terms of whether a person's going to say agree or disagree. I imagine this has got to be a pretty useful diagnostic tool on your end for people basically talking about, like, is this medication worth taking?
Yeah, exactly. I think the one thing that comes to mind here is people associate side effects with this question a lot.
I can imagine.
So do the side effects outweigh the good things of the medication? And that's again, we tend to focus a lot on the negative regarding medications, right? Like, oh, this can cause nausea, this can cause sexual dysfunction, this is going to make me like trouble sleeping or weight gain, but what is it going to do well for you? Oh, I might be able to, go to my job. I might be able to hang out with my families. I might be, able to function.
I can get out of bed.
Get out of bed. Yeah, I can take a shower. So
all of a sudden, my ability to get an erection doesn't matter so much if I'm able to get out of bed in the morning.
Right. And your erection might improve, like, if you do start doing all those things and feeling better and getting back to your normal routine. So so that's usually what this question goes down to, is a lot of side effects and kind of talking through that, and that for the most part, these medications are fairly well tolerated. Most of the time people don't have side effects, and if they do, they usually go away after 1 to 2 weeks.
I'm worried. So question number 4. Also, yes, I agree. Rosin said, considering the laundry list of side effects that come with meds, I'm sure it's a common fair assumption. Absolutely.
Absolutely. Yep.
I'm.
The thing.
Oh, go
Oh,
ahead.
sorry,
Go
real fast.
go
Real
ahead.
fast and side effects. So that the reason for that laundry list of medications is because if it happens in the studies, I think it's a requirement from the FDA that it has to be listed if it's like if it occurs greater than like 5% of the time. So, um, there's sometimes that side effects that are on that laundry list are actually not really associated with that medication. It could be due to something else that happened in the study, but since it occurred, they have to put it on there.
From a legal standpoint, you're better off with that too. Better to list 100
Mhm.
side effects and have you get none of them than to list 2 side effects and then all of a sudden have a bunch of stuff happen to you that you weren't prepared for. So a lot of that is really designed to help you create, again, realistic expectations for what to expect when you take these things. All right, number 4, agree or disagree. I am worried about the impact of side effects. I have to believe like everybody says agree to this. Like, is there any time that a person ever says disagree to this one?
No, it's always agreed. And I just see some comments here about the 5%. No, the 5%, it doesn't relate to every adverse event that they put on there. It's just for the most common ones. There's just some concerns about, wait, 5% may cause death, 5%? No, that's not the case. Usually those are like less than 1% or just some rare phenomena that happened that, again, may not be actually associated with that medication.
But a thing that's important to remember here, chat, is that the United States is absolutely ass backwards with the fact that we allow drug advertisements, prescription drug advertisements on TV. It's absolutely nightmarish and dystopian that we would have something that has to have an actual medical professional prescribe it, to have that go to the consumer so that you go to the doctor and ask specifically for a medication or hear even the side effects of a medication that you may or may not even be eligible for or should take. So always keep in mind that, like, if you're seeing drug advertisements on TV, you should be absolutely disgusted by the fact that that's even allowed in the United States. I'm pretty sure it's like the United States and New Zealand are the only 2 countries where that's allowed. It's
Every other
absolutely
country is
insane.
banned.
It blows my mind that that's a thing. I think it would be better to have cigarette commercials than it would be to have prescription drug commercials, because at least you can go access them and they're legal to grab. But like to have it, oh my god. Anyway, that's a soapbox for a different day.
Yeah, that's a whole nother story there.
Holy shit. All right, number 5. Agree or disagree. In my culture, taking medication is frowned upon. I got to imagine more people say agree to this than disagree.
Yeah, because sometimes when people think about culture, they just think of, the typical like ethnicities and that type of thing. But this could also just be like family and social culture. Like maybe, again, this is a big stigma question right here, right? My friends, they're like, why do you need those medications type of thing? Like, so yeah, I tend to see this be agree for my patients because of kind of that social dynamic culture that goes on. Family's a big one too.
Yeah. Yep. I think that's so what's interesting about that one from my standpoint, because this is one that I would see a lot in terms of like what people learn about taking medication. I mean, I can tell you a personal story from my own life. I learned that from the way that my parents and some family members have interacted or sort of perceived drugs over the course of my life. I sort of learned that like drugs are a last resort, and that if you're taking them, like you really are past some kind of limit. That's not actually true. That's just something I learned. And I think it's really important for people to be mindful of the fact that just because you learned something from your family or just because you learned something from your culture doesn't mean that it's actually true and actually useful information. And if that actually presents a barrier to something that could help you, then that ends up not being a great thing. And then we may need to restory that narrative or help you create a new way of looking at this, that you're not borrowing from from a group of people or from a learned experience that's maybe not even accurate. So
right, or potentially even setting up boundaries if it's not going to be healthy.
Exactly. Like if you're going to start taking lithium and your family's going to give you a hard time about that, yeah, we may have to start getting some safeguards in place where we're saying something like, if your family starts encroaching in this and saying this shit, how are you going to create some boundaries? How are you going to follow through with those boundaries? And what are you going to do to make sure that this is something you continue to do, especially when we figure out that it's working for you? Okay, so we go to question number 6, which is medications have not helped me in the past. I have to believe that this is a really important part of this assessment because, one, this may be down to perception, but it may also be true. If a person is going to say agree to this question, I have to imagine it's going to make them more hesitant to want to introduce medication now.
Mhm.
Whereas if they say disagree, it may make them more open to medication. So, in your experience, where do people tend to fall on this? I'd be curious.
I would say for the most part, people tend to agree with this statement. But I would say maybe like a 51-49, because some people do have the insight into what's been going on. Again, I work on an inpatient setting, so patients are tend to be a little bit more severe on their illness. So sometimes they might not have that insight, but some people realize like, hey, I'm in the hospital, like this is where I'm at right now, and they might be a little bit more open to the medications. But when I've been working, when I round with a team, a lot of my job is to kind of help convince the patient, or I guess, lay it out in front of them, like kind of the benefits of taking the medication to hopefully improve their situation, what they got going on, and kind of there. So
And
I definitely okay.
well, no, I mean, it's interesting because when you say, I imagine that when you say the word convince, that might make people real, and I want
Mhm.
like I want to make sure that I reiterate that, and you've been very clear about this in the same way that
Mhm.
I always am, which is that like we're trying to figure out what's going to work best for you, and a
Mhm.
lot of cases, like when we get to a point where you're talking to a pharmacist or you're talking to a psychiatrist about psychotropic medication, it's because we've tried other stuff that hasn't worked and we need the extra boost. So by the time you get to Monster, talking about the benefits of medication is going to be more fitting, as opposed to like if you came and talked to me, I'm not immediately going to jump down your throat with medication. We're going to try other means of treatment first. But by the time you get to him, he is going to want to talk to you about the benefits of what's going on because we've reached that point. So you need to see it in context as opposed to something where you're going to get hit off the front with people trying to convince you to take medication, because that rarely happens. I think even in your case, right?
Yeah, no, absolutely. I also wanted to say too, it's not necessarily convincing, but like also for the patients that I see again are very treatment resistant, right? So they might not be in the right state of mind to make the best decision for themselves to be successful when they leave the hospital. So again, we're just trying to advocate for the patient
Yep.
as much as possible.
Number 7 is, it is too hard to remember to take all my medications. I imagine this is relative to the person, but this, for me, on my end of things, is the one where I would find myself intervening a lot, right? Like if people are missing their medications, if they're misremembering it, if they're having a hard time actually getting a regimen in, we're going to start building discipline. We're going to start building in reminders. I'm not going to shame a person for that, but we're really going to work on some modification there to get that to be something that a person is integrating into their life. Because not only are you dealing with the biological changes that come along with ingesting medication, you're also dealing with the behavioral change that comes along with that being part of your routine. And for a lot of people, introducing new things into their routine is very difficult for them and is not something that they're generally ready for or used to. And that's going to come along with it some anxiety. You are going to forget now and then. We have to emphasize how important it is to keep it consistent and make sure that we're creating a structure where you can be successful with that. Anything you would add to that one?
No, it very much behavioral modification that I try to relate to my patients as well. So, like again, phone apps, like you mentioned, put the car keys right on the top of the medication bottle, put it next to coffee or next to your toothbrush. Just something that's going to be beneficial for you. We also have like pill boxes that I give out too, which the Sunday through Saturday type of thing to help organize the medications and when you need to take them.
And if I haven't emphasized this enough, chat, there is no shame in doing any of that. If you do not let your pride get in the way on this. There is nothing embarrassing about using those pill boxes that are labeled. There's nothing embarrassing about putting your car keys on top of your pill box to make sure that you remember it before you leave for work. Whatever you have to do to remember is super important, and don't you dare let anybody ever make fun of you for that, or let anybody infiltrate your mind that that's somehow stupid that you're doing that. It is super important for you to get this stuff in consistently and to be engaging in this. And if you have to do that in order to make it happen, then that's what you got to do. I would argue the number one thing I run into that stops people from doing this stuff is just shame associated with it.
Yeah.
All right, number 8. When my family, loved ones, or members of my treatment team want to be involved in my medication, it's because they are concerned about me. Boy, oh boy.
Yeah, this is a big one.
This is a huge, I mean, especially on my end, this tells me a lot about a person's past experience with this and also their perception of doctors and people that are attempting to work with them in these capacities. Because if you are perceiving a caregiver or sorry, not a caregiver, if you're perceiving a medical professional as caring about you and being concerned about you, that generally is going to help people feel more comfortable with the idea of doing what this person suggests. In the same way that the alliance is a huge part of therapy for me, I got to imagine that perception of why you're prescribing what you're prescribing is deeply important, because that's going to invite people more into the process. So this one's one I'd be really curious too about, like what this one's like for you and how this one impacts when you're talking to people.
Yeah, this one is, I feel like, is it kind of has to dissect it based off whoever's kind of speaking in their own experiences. So like when it comes to family, depending on their, family dynamic and what's been going on there, that might be agree or disagree. Kind of same thing with the treatment team. Sometimes there's some opposition from the patient's side, but again, we're just trying to advocate for you at the best way that we can. And for us, like, the patient is very much a part of that treatment decision, right? We're going to try to figure out the best medication for you. We're going to provide recommendations, but at the end of the day, there is, the patient does have a say in like what they take to, to an extent. We do take that into account. So don't feel like it's just us telling the patient what to do. It's very much we do hear you out and take that into account.
This is a fine line though too, because something I have to help people also understand is that, like, at the end of the day, unless you are a pharmacist like Monster or a psychiatrist, you don't know as much about this stuff as they do. So there is, you do, in some cases, you can advocate for yourself, you can speak to your experience, but you're also not, you're the expert on your experience, but you're not the expert on the medication, on what it's going to do to your body. There's a reason that Monster had to go through tons of school and go through residency and do all this shit. Like, this isn't stuff that you can just Google and all of a sudden you know as much as Monster does when you're sitting there talking to him. So there's a fine line between self-advocacy and bulldozing professionals and experts, and we like to try to help people. I like to try to help people find that optimal zone.
Yeah, absolutely.
All right, next one is, I don't need medication to deal with my mental health condition. This is a really interesting one for me because the need is the one that really stands out to me here. Like, there are instances where medication really is the thing that's going to help. Like, where I like, if I hit my limit in terms of everything I know to do with a treatment plan, and let's say I make a referral to another therapist because the person's hesitant to do medication, and especially because I suggested that was the case, they go see another therapist and the therapist basically says the same thing. There's a good chance that medication actually would be the thing that you need in order to work through what it is that you're working through. And so this one's weird to me because I think it sort of presupposes that the client or patient knows that they need medication, and I have a hard time with that. So I'm kind of curious what your perception of this question is, or like why this is one that's on the assessment.
Yeah, this was probably the one that I actually tend to skip over because of just it's pushing the patient into a direction and not really allowing for discussion per se. So I usually don't talk about this one with my patients. But because usually, like, patients, for the most part, again, when I see them, they know that they need medications for the most part. But from a general stance, there's, like you mentioned, there are things that we just need medications to treat, right? So like for like schizophrenia, hallucinations and things like that, they're just not going to go away on them on their own. So there's a problem with dopamine, and so we need to kind of help regulate that in our body. And the only way that's going to happen is through medications.
I do think, I will say though that despite me and Monster not particularly liking this question or this statement, there is utility to it, which is that if a person answers this as agree, that tells me a little bit about their attitude toward medication, right? There is something that has created that perception, and maybe there's a degree of resistance there that is worth being explored.
Some sort of barrier that's going on.
Absolutely. And if a person says disagree, then that probably shows a level of openness to the process that I now don't have to worry as much about what it's going to be like to refer them over to somebody like Monster. So there is utility to this, even though it's kind of like worded weirdly. There it is. All right, the next one. Medication can help me achieve my goals. I feel like this falls into the same thing. This is more
Right.
of like going to be a psychoeducation thing where you or I is going to be the one that says, yeah, I actually think it can. And we're going to explain how we think it can. I don't know that the
Right.
patient really has much. It's not useful to really hear their opinion on that one.
Yeah, it's kind of for those that don't necessarily maybe not at that level of insight into what's been going
Yeah.
on and how medications can help. And then yeah, you or I can go in and be like, hey, medications can help with X, Y, Z.
I think this
and
is
kind of go from there.
this is a statement that likely is going to fall, like, is going to make more sense in the context of how people have answered the other ones.
Mm-hmm.
And then the last one I think is this is the one that you alluded to being really important, which is it is embarrassing to take medication. And I think there's only so much psychoeducation and so much understanding that a person can have in terms of like understanding medication and what that's going to mean for them. Embarrassment usually has absolutely nothing to do with the efficacy of the medication and what it will potentially do for them, and has everything to do with what they've learned from other people and what they've seen represented. And this is the number one thing that I see preventing people from even asking for a consultation with a psychiatrist. And I have to imagine this is the thing that when people show up and talk to you, they're struggling with the most.
Yeah, this is probably the question that I spend, or the statement that I spend the most time on, and just really talking about stigma surrounding mental health, and give the examples that we gave earlier about how mental health is very much similar to high blood pressure or diabetes. There is some sort of organically our levels are not regulated appropriately, so it's okay to take medications to help with that. Go to therapy, exercise, do all of these things together to help alleviate any of those symptoms that somebody might be experiencing. So
Excellent.
stigma's a bitch.
It is. And so the final point that I want to make about something like this, because I could imagine people wondering this is not a tool that's used to convince people of anything. This is an assessment tool. This is something that we would use in our respective capacities to try to get an understanding and really hear the patient out so that we understand where you're at. Because if you're a person that is totally okay with taking medication and is all in on it and has no real barriers to the idea, then it's going to be a lot more simple to get to the nuts and bolts of, okay, so then let's figure out what it is that you're going to take and what's the diagnosis and what's going on. Whereas if there's
different things we can talk about, right?
Absolutely.
Yeah.
So if a person fills this out in a way where we see lots of resistance here, this is for us to see that resistance very concretely and to be able to have a discussion with you, not to convince you over these things, but maybe to help understand you a little bit more, help you feel like you're more invited into the process, and really have more of an informed decision of what's going on with a referral in my case, or with the actual medication in Josh's case.
Yeah, because if you don't tell us, or we don't kind of go through these tools type of thing, we don't know. We don't know what's going on. We don't know what the hesitancy is, what issues or barriers that might be there, or experiences that you've had in the past, and we want to try to be able to work through those to where we can get to a spot where we can talk about and have a discussion and kind of give the pros and cons of whatever it may be.
I appreciate you very much, my dude. I'm sorry I can't stay around longer.
All right, man. Always a pleasure, man.
we
I
will
love hanging out with you,
absolutely
talking about mental health and stuff. So thank you to your chat for inviting me in and always having good questions. Honestly, these are really good questions to ask, and this is what we're here for, to help answer them and provide education. So
absolutely, Chad, as I always say before I leave, and I mean it for each and every one of you, and I hope you say it to yourselves as I say it to you. You matter. Your experiences are valid, and don't let anybody ever tell you otherwise.